Hi, this is Dr. Mark Sehl. I'm here with Dr. Donald Morris tonight, and you've seen him on videos before. We talked about different things. We talked about working with people who were sexually abused, and Donald presented a case of son incest, where the incest continued on until that son was in his mid-20s or early 20s. Very, very interesting case. So Donald is here to talk tonight about technique, working with patients, and how to treat them. And Donald has a lot of experience working with various people and all different kinds of problem situations and diagnoses, long history. And he has a website, drdonaldmars.com, right?
Yes.
You said that yes before.
Mhm.
Someone liked the way Donald said yes last time. That was their comment. And he's very spontaneous. They did. That's a fact. When somebody was talking to me about the video, they liked you very much. So I'm just stroking you, Donald, a little bit.
Oh, they have impeccable taste.
See, yes, sir. So thank you, Donald. So you're going to talk about treatment. And at the end, in case I forget, you can contact Donald at Dr. Donald Mars at AOL.com, or
Yes.
That's right. And his number is 212-682-7568 also. And on his website, he has a download of the case that he talked about too. So you can go to the website and you can download that and read it to your own enjoyment. Right? Okay, Donald, so welcome to the YouTube channel, Therapy for the Heart.
Thank you.
You've got a lot of heart, I'll tell you
Lot of
that.
heart.
I'm saying that because he came on that time and he presented himself, which Donald was very courageous to do, about how he was recovered from pancreatic cancer. And he's still cancer-free, and it's the 4th year. And that was called Up From the Mat on YouTube videos, so you can check it out. All right.
Thank you.
Yeah, you're welcome.
We left off last time we spoke about, as you said, patients that were abused, emotionally abused, physically abused. That includes sexual abuse. And yes, I'd like to address the other side, which is how we work and how we treat this kind of issue. Let me first back up. In our previous video, I commented about how in the unconscious, a person comes to see us looking for the good parent who would help them. And I think this is really, it says so much about the human spirit and the human condition. Think about it. We're talking about someone who was abused, who was betrayed by the people who love them and should be protecting them at God knows what age. But these individuals were betrayed emotionally, sometimes physically, which includes beatings, or verbal abuse, which can be extremely harmful, sometimes even sexually abused, which is another kind of a betrayal. And in addition to that, are living their lives, which is filled with dissatisfaction and inner conflict and turmoil because of the betrayal and hurt. And despite all of that, still have enough in them to want help, to want a better life, to look for that wished-for parent that would help them have a better life, resolve these kind of inner struggles, despite what they have lived through in their earlier life, and despite the interference and the conflicts that caused which make their current life unsatisfying and filled with conflict. And they still come for help. I find that just a wonderful commentary about the human spirit and our desire to get a better life for ourselves. So saying that, the person who's in that position comes to our office. And yes, they are filled with inner struggles which have affected their current life. And that's probably why they're there, because their current life is filled with all kinds of knots and conflicts, dissatisfactions. And they're coming to see us to try to help them get through this, to resolve it, and to get to a place in their life where they can resolve some of these terrible struggles that go on between them and people, their loved ones, husbands, wives, children, parents, friendships. It's also important for us to realize that all those kind of struggles will then reappear in the relationship with us being a therapist, analyst, whatever you want to call us. Actually, that's what makes this kind of therapy work, because it reanimates all those kind of struggles, and the struggles will become activated and live between the two of us, between the patient and someone like me who's doing the work with this person. And because it's a live struggle, fully activated and felt deeply by both of us, that enables us to do the work, providing, and here's the biggie, providing the patient can tolerate the anxiety and the stress that brings, and the therapist can tolerate those feelings in himself or herself and be able to work through them inside, and at the same time help the person they're working with, the patient, come to grips with that stuff without either acting on it or doing things that would be not in the patient's best interest, which is to say, not helpful. A lot easier to say than to do. When Dr. Sehl had his last video, he was talking about, quote, the difficult patient. Well, that's our way, meaning ours is the therapist's way, of trying to put the onus on the patient. You know, they can be difficult. Yes, those are the kind of struggles that they're going through make their life very difficult. And that's what makes it difficult with us, because they will be reactivated with us. And we have to kind of figure out and deal with those feelings and deal with whatever the struggle is going on to help resolve it so they can move on. And yes, it can be very hard. It can be very difficult. Again, that's what makes our training and our own awareness of our own self so important, that we don't get caught up in this struggle, in this interpersonal relationship, and do things or act in certain ways or say things that do not help move on, don't necessarily gratify us, but keeping our eye on the ball, which is to say, to work with the patient's material and struggle within ourselves, and we often do, to enable the work to proceed. That's the treatment. To struggle with the material to enable the work to proceed. Now you might be saying, well, what's he talking about? What kind of issues are we talking about? Well, Dr. Sehl addressed some of the issues that we talked about. For example, the person who puts up a wall of words to keep you apart, to keep you at arm's length, to make it impossible to be able to have a connection, has no idea what they're doing. This is not an intentional plan on their part. This is what they do in the real world. And so, duh, why don't they have relationships? Why do people walk away? And the same kind of feelings that would make people walk away would make us turn off, get sleepy, go to sleep, distance ourselves, want to put them down, do a whole host of stuff, which is not in the patient's best interest. Our job is to be able to tolerate it and to understand what's happening so that we can ultimately help the patient understand what's going on and work through these difficulties so that they won't be involved in behavior like that, so that they will not chase people when they're trying, when part of them is trying to just do the opposite. Otherwise, why would they be trying to meet people? Why would they be at a party? Why would they be on a date? Because they want to make a connection, but there's some part of them that is interfering with it. And that's the same kind of struggle that will go on with us. Our job is not to fall victim to our feelings and chase them out, or say they're just too difficult, or they are, what's the term, therapeutic, negative therapeutic effect, so we can terminate with the patient. No, that's what they experience in real life. That's not why they came to see us. So yes, but both the patient has to be able to tolerate that, and we have to be able to deal with that. Now, Dr. Sehl made reference to my patient who invoked in me, for example, a feeling of that I'm wonderful and that I should, he would give up his own autonomy. I should take care of him. I should be available 24/7. Anything that he needs, I should be able to supply anytime, talk to him day or night, be available to him, as a previous therapist did, which I understood to mean what he was doing was recreating that same kind of symbiotic relationship with, in his case, it was his mother, trying to keep her alive, give her what she needed, because if she was alive, then he was alive, because he couldn't survive without her. Her message to him unconsciously was, I can't survive without you being part of me. that's not what I wanted to do, to recreate that. And even though the tug was strong, yeah, we have to resist sometimes for the better good. And it can happen in all kinds of ways. And I mean, we both have experiences, for example, with sexual material or with anger. Both of can be used very efficiently to keep us at arm's length or to make us uncomfortable. And yet, to confront the patient, or to, God forbid, act on those feelings, is not at all what the patient is there for. That's the treatment. It's not easy. It is difficult. So when Mark was talking about the difficult patient, it's more the difficult work.
I also want to emphasize too that the last video was to challenge the notion of the difficult patient, because one of the main points that I was trying to make, because I think it's a prejudicial attitude that people have about the difficult patient, because what they're doing is they're putting the responsibility on the patient and not on their own feelings, examination of how they're working, their countertransference. So this is a term that's been bandied around, the difficult patient, which, one of the reasons why I did my dissertation on erotic transference, countertransference, is because I read the literature, and much of the literature was blaming the female patient on these stalemates in therapy because of her erotic countertransference, and there was very little material about the therapist's erotic countertransference.
Mm-hmm.
So that was another example of what spurred me to do my dissertation on the incidence of clinical social work, of erotic countertransference in clinical social work practice. So that's been my history of thinking about what's important to treatment has always been on emphasis on the therapist's responsibility on outcome much more than the treatment. And as Donna was talking, I was thinking about, what happens, what's induced in your feelings when you're working with something. I thought about one thing that happened with Jane. You remember Jane? Refer back to her because it has a lot to this talk where we're talking about in the detailed description of what happened in therapy. But anyway, there was one moment when she became very important to me. And I began to feel, well, I'm not supposed to feel this. This is something that, I don't know where I get this. There's a lot of supposed to, so sometimes I make them up. It's not that I make them up, but they're there because they're unusual to happen in treatment. They don't often occur, and so when they occur, they're somewhat unusual. So she became very important to me. And then I remember reading this comment about that Sehl's made about there's a time in treatment when the patient becomes very important to you, like your life it's not that much you can't go on without the person, but if there's just such an interconnectedness that you feel, and it's just like the mother felt for the infant, and how important that infant was to her. So that was a repetition for me of something that I know Jane never felt with her mother, because her mother was too intrusive, too trying to take over, too critical. They never had that moment together where that was like the moment in the treatment where she said, well, okay, now don't talk too much, Dr. Sehl, because you were very silent this time, and I really enjoyed that session. So we were together and close, but also I wasn't fighting off being close to you. So there are moments like this which transpire in therapy,
Yes.
which were very unusual.
Well, that's what I was referring to when I was talking about it recreates a real powerful experience between the patient and the therapist. That's a real powerful emotional experience that's going on. It's been activated. And just that experience that you were feeling and that you allowed yourself to, you could tolerate. It didn't frighten you off. It didn't chase you off. It didn't make you, pursue her in different ways. You understood what was going on and you could tolerate it. And that allowed the patient to experience something and to move beyond it.
Some people would be very critical of that, of a therapist having a feeling like that, and that's why when Donald said, "I wonder how you experience us talking like this," because if you might be coming into therapy and you have a little spot of I don't know, in your life of depression because of a breakup with somebody, for instance, and when you're coming in, you're not interested or you're not thinking about this is going to be a longer process where all these things are going to happen. You're coming in, you want to get rid of the pain that you're feeling, the depression, the loss that this breakup has reminded you of other losses in your past, and that has a lot to do with your depression. Although you don't know it at the time, you'll find that out, and once you can talk about that, your depression will lift. Good chance. You're not thinking about coming long term. So, but that does happen. I mean, it does happen. And Jane I saw for 4 or 5 years, and more than that. About 5 years, three times a week. As a matter of fact, if I look back on it, I probably didn't need to see her that often. And that might have been part of the problem. It could have been, in terms of her being fearful.
Maybe not.
Maybe
don't
not.
Don't second guess yourself that way. Maybe seeing her that often was helpful to her.
See, he just got my defense right there. Second guessing myself. That's very,
but it's true.
He knows me. He knows
I
me
know
very
you.
well.
Yes.
He knows me.
I know you. But it's also true that, sometimes the frequency depends on a lot of, how often some persons could be seen depends upon a lot of different factors.
Right. A lot of different factors.
Yeah, a lot of different factors. The point is that it worked.
It worked. Yeah.
It worked.
Yeah.
So, could it be done differently? Maybe. The fact is that it worked this way.
Right.
And that's wonderful. That's wonderful. You tolerated or needed to be tolerated.
Oh,
She
boy, did I tolerate
she took
it.
from it. She took what was needed from it. And that allowed her to move into her own development to move on.
Yeah, and she tolerated too.
Yes,
That's what she did.
that's
She
important
grew.
that she can
Yeah.
tolerate it and that you can tolerate it.
That's the half of the battle in terms of working with somebody. Not it's the battle particularly, because sometimes
Yeah.
it feels like that about helping someone that you're working with be able to tolerate and live with feelings that they've never been able to live with, and how they've avoided it with the various defenses that we talk about, like rationalization, denial, reaction formation, things that they learn to live with so that they can avoid, or drinking, drugging, that helps people not feel things, So all the many ways that, and I was thinking too, when watching these videos, they're about the patient and the therapist, but they're also about people in general. And I think people, when they're listening to this, you can think about it as, okay, you may not be interested in therapy per se, but it may ring a bell with you in terms of being in a relationship sometimes, for instance, and thinking about what we're talking about transference. And it might remind you of some woman or man that you started to go out with and you have very strong reaction, very negative reaction. And somewhere along the line, you might have this intellectual recognition. Well, he's like my father, or she's like my mother. So these videos also are for the general public in that sense that maybe, somebody just wrote to me on a little note about one of the videos. I don't know which one it was. I'm not sure, but her comment was, I didn't know if it was okay to hide. And that, the podcast and our YouTube videos are framed with, it's a joy to be hidden and disaster not to be found. So those two things are very predominant in people, and that connected with her, like it gave her permission, because that's what we say here, is we help people hide if they're not able to protect themselves, and to help them protect themselves, and also we want them to feel someplace that they can be authentic. We might be the first place, and they can say, they get pissed off at or at us because we're not doing the therapy that we're quick enough, or they can say these things, or they can say I love you, where it's not safe at other places, and they're not going to get thrown
Let me
out.
go back to what somebody just said. I'm sorry to interrupt. I
No,
don't
go
want
ahead
to
and
get
interrupt.
lost.
Good. Good. It's
That,
good. It's good
that
to interrupt.
intellectual awareness of, oh, I experienced that with, whoever, mother, father, whoever. That kind of an awareness is the starting place. That's not the ending place. That's the beginning of the trip.
Right.
Becoming aware of that and doing something about it can be different. That could be very separate. Very few people have the ability to do this kind of work by themselves. It really requires, most of the time, for most people, even Freud couldn't do it too well by himself, but it requires help and the ability to reach out, despite the fact that you've had all these betrayals and hurts in your life, is again the remarkable part about the human spirit. But if you can identify, oh, that reminds me of, that's a starting place. So don't be too tough on yourself. If you can make that recognition, and have trouble taking it beyond that. That's generally what we do, is help you take it beyond that. I don't want people to feel disappointed if they make that recognition and then feel stuck.
No, because it's a starting point.
It's a starting place.
Yeah,
That's not
if
the
they-
ending
if
place.
If they can use it that way, and sometimes I think they may connect with what we may talk here, and they may have that starting point, and then listening to some of the videos or the podcasts, that will help them come in, because they can identify, I'm not alone. I'm not alone with this. I'm not alone with this problem. And yeah, maybe I pick all the people, and my friends have told me that I pick the wrong people all the time. They say that all the time to me. So maybe this will click at some point. We'll say, well, yeah, maybe something's going on with me that's bringing this about. And it's not just that the people that I'm meeting are not
Yeah.
the right people. You know,
People
so,
we have wonderful radar, or whatever you want to call it.
radar is a good word.
Yeah, we tend to select out those certain kind of people that somehow we know where this is going to go. I'm not blaming anybody when I say that. It's like, how many times you get into a relationship and the guy, the gal, whichever it is, winds up being an alcoholic, for example, or someone who's super critical, or who's non-giving, or whatever. You go through it once, twice, 3 times. Sometimes we can say to ourselves, hey, how many times have I been down this road before? How could it possibly be that I keep picking women who wind up being alcoholics or wind up being whatever?
You know what? Something, too, is very hard to make that connection.
Yeah.
Because at that point, it's very hard for people to take responsibility for their. I did a video or talk, a podcast, or whatever, but the focus was, why can't people take responsibility for their behavior? And one of the things that if you take responsibility, then it's on you, and then you can say, well, what am I going to do? How can I work with this problem? Even though you're saying that I have some responsibility in it. It's an overwhelming feeling that when it's all on you. So, because really, what can you do? You can go to therapy.
Yeah, that's what you can do.
I understand that, but the responsibility of carrying that weight is very difficult for people too. That it's easier to see that the problem is outside oneself, because to see that you know what it is? I think it's because there's self-blame enters into it, and when people feel that they're responsible for their participation in this relationship that's repetitive and repetitive, they may tend to blame themselves
Yeah.
for it, and that we have a lot of that. So that's why it's difficult. I often say to people, well, it's like you're taking a black brush when you find something out about yourself and you start becoming critical, and you're painting it over your whole person, not just some aspect of things that you do in life, but you become a terrible person because of this self-blame. So
Sometimes I hear, oh, you just want to blame my mother. Oh, you want to blame my father. Oh, you got to blame somebody else. Actually, no. Blame has very little to do with what we do. That's the part of them that's so harsh and so self-critical. That's blaming somebody and laying it off on us.
Well, it's interesting too, because there's another. I'm thinking about that too. It's blame has, right? It's not blaming, but what has a lot to do with our work is we want to help them. People are sick because they're recovering from the blame and the fault finding that was laid onto them, and the anger related to it, the anger related to being attacked, being ridiculed, feeling devastated, being beaten because they said the wrong thing. So they have never found a way, nor should they, about reacting to that and saying, I don't like that. I don't like that when you take a strap to me. I don't want you to do that.
Mm-hmm.
You know? And this is a place where they can come in and say to us, once they have the courage, and that takes a long time, I don't know how long a time, but to have the courage to say, you know, I don't like what you just said to me right now.
Oh,
That's a long time.
it's a long time, yeah.
But this is a place where they can say those kinds of things, or, you know, I hate you when you seem to be falling asleep in the session. You know, I don't like that. Or they might not say that. That's another thing that they might keep to themselves. But we help them elicit that kind of response, the kind of response that they could never make to their mother or father, whoever the caregiver was, because this is a place, hopefully, for us, that it's free. We're not going to throw them out. We're not going to reprimand them, scold them for saying the wrong things, scolding them for attacking us.
But that's only the reality. What you're saying.
Yeah.
The inner reality for the person.
Their think is that we're going to do that.
They have a whole different. They have a whole different. You'll never want to see me again.
Yeah.
You'll say, "Who the hell do you think you are? Get out of here. Never come back."
Right.
Or whatever.
For him, and then for us, help them say that too, is going to be a big step, because that's going to be hard for them to say too. They're not going to walk into the room and say, "Oh,
no,
I was afraid of coming because I think you're going to throw me out there the minute I open my mouth."
Right.
Yeah,
they won't say it.
That's why they don't come in this door and see us, because they have those fears,
Sure.
those terrible fears.
Sure.
They're going to be treated like crap, like they were treated. Yeah.
Right. But the fact that they can feel that way with us is the beginning of the therapy. That's what makes the therapy so powerful, and what makes it work.
Absolutely.
Because they can experience those feelings with us.
I had someone come into to therapy with me. She's made wonderful progress, but she was from another country, and she could not go to a therapist in her country because she was so ashamed about the interaction that she had, which I won't go into details, was pretty awful with her therapist. So she said so much shame she wouldn't set foot in a clinic or a therapist where she lived. But she came
think about that. That's amazing. She wouldn't see a therapist in her whole country.
No, that's how much shame.
That's how much shame.
That shame came from the way she was raised, because she was made to feel like an inferior child compared to another child in her family. She was made to feel like she was less than them. And what a remarkable ability to come here.
Yeah, despite all that.
Yeah, she found me on the videos. Thank God for the videos, because maybe she wouldn't have been able to find some place where she could find
and to make that kind of a compromise, which is wonderful that she could even do that, despite the shame she was feeling.
Despite the shame.
That she could reach out and say, something, I can't live this way. I want something better for myself.
Right. That's the spirit.
That's the wonderful human spirit that comes into play. Sometimes it doesn't work out well. mean, for example, many years ago, a man came to my office for a consultation. Now, this is a man who I had met previously before. Obviously, I knew him previously, and he knew my work, and he had a sense of who I was. It's a man who was a big guy. He was a 240-pound guy, 225. He was a big man, and I say that because what I'm going to say now. He had a lot of treatment experience, a lot of therapy, but he was a man who was really quite bright, but really damaged by his life, his early life.
Did his bigness have an impact on you in the
Well,
beginning?
I want to give you a picture of this. And he came to see me for the consultation, and he's told me that he knew me in a way he did from our previous contact, and he wanted to work with me because he felt I could help him, but there were certain parameters and certain ways he wanted me to work with him. He said he wanted me to shave off my beard. He wanted to sit on my lap during the sessions, gaze into my eyes and touch my face. No hair, to touch my skin and gaze into my eyes while we had the session. He said after the session, he wanted me to take him back to my home and to have dinner with my family as if he was part of my family. But there's no as if.
Instead of remembering, he wanted to do it.
Right.
Yeah, I remember.
Now, as much as I wanted to help this man, I don't know how to work this way. I'm not sure it would be helpful. I'm not sure I could do it. And I took it on myself, and I told him, as much as I would like to help him, I don't know how to do this, to work that way. And it was my failure as a therapist that I could not meet those kind of needs in that way. I could work with another way, which he adamantly refused. He said, no, I did the other stuff before. This is what I need. Unfortunately, I couldn't work with him. I liked him, but I couldn't help him. Not with those parameters.
No, and I imagine you have your reasons why you think it might have not have worked, even if somebody did work in that modality.
Yeah, I don't know if it would ever work.
Yeah.
But
well, there are some.
It was beyond my ability.
There are some practitioners who will say this is you're going to recreate. You're going to have a rebirthing experience, or sort of.
Yeah.
Yeah, and they're going to be like a baby, and you're going to hold them, and you're going to the treatment will be giving them everything that they didn't have in their life, and experience that. And by experiencing the love, the care, and the attention, you will they will change their personality. Their problems will be effective.
I don't know if that. I don't think so, because I think that's. I mean, he's not a baby; he was an adult, and
But he wants to be treated like
as if he's a baby.
Yes.
And he's not a baby; he was a functional adult.
Yeah.
I mean,
but he has the emotional desires of a baby.
Of a baby, right?
Yes.
But to treat him that way, actually physically treat him that way, I don't want to see him in diapers, and I'm sure as hell not going to change a diaper. But how far away from that is he talking?
Yeah, he's not far away.
Not far away.
So what he's talking about is acting in, to put, instead of putting things
into words
and have memories of how difficult it was for him to be so neglected, which is he must have been, very neglected. Instead of having those memories, which are terrible to remember, he wanted you to do something instead to recreate the original experience, and then have that would be curative. It doesn't work because it just doesn't.
It doesn't work.
It doesn't work. You can't. Those memories are not going to go away by you recreating a different experience for them, in my opinion, anyway. But, and matter of fact, the person that I was just mentioning, that came from another country, she is having those very kinds of expectations, but she's talking about them.
Hmm. That's the difference.
Yeah,
She's talking about them.
Yeah, got a lot of courage and disappointment, and, but she's facing it all. So it's great. I think we might be around time. It's 8:29. I don't know what time we started.
Well, we can stop.
Oh, it's 40 minutes. It says it right here.
Okay. Then
40
we certainly should
well,
stop.
Around this time, because I'm sure maybe people can, that we need to get going too ourselves, not just the people out there. So, but that's a good time, 40 minutes, because you know what they say about these videos? They should be a certain time. As a matter of fact, they used to say the best therapy video, 5 minutes.
Well, therapy doesn't take 5 minutes. Therapy takes time. And how long does it take? It takes as long as it takes.
That's right. That's right. So that's why we're going to.
There's no pill that can do this.
Okay.
There's no pill. It just takes time.
So thank you so much for listening. And Donald has a very wide insight in terms of what his approach is to patients, and he was interlocking with me here in terms of how we both work and how we treat people, and we're very along the same vein.
Yeah.
I think, yeah, we talk the walk, and we walk the talk, and we talk the talk. Is that how's it
Yeah.
goes? How's it go?
And we want something like that. We walk the walk, we talk the talk. Or,
We do. We try anyway. We try hard. So we
Mhm.
try, and also we appreciate. I appreciate your listening, because without you listening, and we wouldn't have this YouTube right here, and you're continuing to follow. So please like this talk. If you like it, there's a button you can push if you like it, and also subscribe. If you want to make comments, you can get a Gmail account, and do that and make comments, and you can contact Dr. Donald Mars at AOL.com, and reach him at 212-682-7568, and you can contact me at marksehl@gmail.com, or you can contact me also by phone if you want. So you'll find that information up there on the websites. So without further ado, we're going to say good night.
good night.
Okay, bye-bye.